About mental illness, moon is the main culprit. Moon is the planet for the mind, and if moon is afflicted, then the mental problems, psychiatric problems, and all these problems occur. Moon is the fastest moving of the grahas, and similarly, your mental makeup is also, changing all the time, very fast. Mental faculties are affected by this moon, and it signifies the mind. Its affliction disturbs mental balance. The other planet that you need to be careful about is Mercury, which is the planet of logic and discrimination. So Mercury is another planet which, if it's affected badly, then this can also affect your mental balance. And Jupiter is the best benefic, preceptor of the gods, and signifies wisdom. So if Jupiter is good, it can take care of some of the problems related to moon and Mercury. But if Jupiter is also disturbed, then the medical problems can occur. Fifth house is the house of thinking, and therefore that also has a role in your mental faculties and mental problems. Fifth house as well as the fifth lord, they are important. And moon is in the sixth house, and it is on the same degree as Saturn, 5 degree, 5 degree. Moon's affliction by Saturn. Moon is very easily affected by other planets. If it is under the influence of the Sun and Mars, then it gives you mental aggression. If it is Rahu or Ketu, it gives you phobias. And if it is Saturn, it gives you depression. And this is a child who was born in the dasha of the Sun, and Sun is also very adversely placed in the 8th house, and he developed mental depression at very early age, and now he is about 22. He is still having those problems and is still on treatment. And this is because too much of intimacy between the Sun and between the Moon and Saturn, and that too in the 6th house, and without any benefic aspects. If there are any benefic aspects or influences, they reduce the intensity of the problem. Yeah, again, affliction of the moon by Sun gives you quick temper, quarrelsome nature. Mars, quick temper, aggression, violence. By Saturn, acute depression, manic depressive psychosis. By Rahu, cunning in thought, phobias, suicidal tendencies. Ketu, suicidal tendencies, phobias, irrational suspicion of others. So these are the things which an afflicted moon can give you. Briefly about the heart disease. The Karaka, or the significator for heart, is the Sun, and Simha Rashi is the heart of the Kalpurush. 5th house and 5th lord, they indicate the heart. So if these are afflicted, a possibility of heart disease is there. Heart disease, 4th house is the chest. 4th house is afflicted only when the heart problems are creating a lot of problems in the chest, in the lungs, and also when you have to do an open heart surgery, which is because you have to go through the chest. So in cases where heart disease is amenable to conservative treatment, the 4th house generally is not afflicted. And if it is, if it requires surgery, then often it is the 4th house which is afflicted, and so you can see whether this heart problem needs surgery or does it need a non-surgical treatment. And there is a principle in astrology that if the Karaka, there is a Karaka, afflicted, so the relevant house from the Karaka also. Fifth house from the Lagna and fifth house from the Sun also. Sun is the Karaka, so fifth house from the Sun also is important in cases of heart disease. And I'll just show you some chart of heart disease. And here, one that Moon is afflicted in the sixth house, so that is a Balarist. Sun associated with Mars and aspected by a retrograde Saturn, and then they are exchanging houses. Saturn in the house of Sun, Sun in the house of Saturn. So exchange of houses means that Saturn and Sun are influencing each other, and therefore it is the Sun that would suffer rather than Saturn. And the fifth house, there is nothing there, but fifth Lord is debilitated here and associated with another adverse planet, which is the eighth Lord, Mercury. So, and the fourth house from the Lagna, you can see this is the fourth house. So this man needed surgery. Fourth from the Sun is also afflicted because Mars is aspecting it and the Saturn is aspecting it. So this was a man who had surgery on his heart, and it was an open surgery because it is not only the Sun in the fifth house, the fifth Lord afflicted, but also the fourth from the Lagna, fourth from the Sun. And so this is just, I'm just, going a little fast through it because these are the basic principles of how you detect a disease. Diabetes, it is characterized by the rise in the blood glucose levels because of poor utilization of glucose. The hormone insulin is required for peripheral utilization of blood, so glucose. So insulin is in deficiency. Insulin is produced by the gland pancreas, which is partly in the foregut and partly in the midgut. So therefore, it is this fifth house and the sixth house both. So paucity of insulin or its effectiveness cause diabetes, and normal liver function is also important for glucose metabolism. So the most important gland for blood sugar regulation is the liver. Most important hormone is insulin. So Jupiter is the significator for liver and also for the foregut. So Jupiter is a significator. Venus also signifies hormones, and Venus is the significator for midgut. So therefore, pancreas, both Jupiter, Venus, fifth house, sixth house, and their lords, they are all important as far as the causation of diabetes is concerned. And I have the chart of a gentleman who was working here in the French embassy. If you have heard the name of Charles de Gaulle, this man was his nephew. He was very grossly diabetic, and you can see that fifth house has got Sun, which is not something very nice, and then fifth house has the 10th aspect of Saturn from here. So this is fifth house afflicted. The fifth Lord Mercury is in the sixth house with Mars, so that is an affliction. Sixth house is afflicted because sixth house has Mars here. Sixth Lord is Venus, that is with Rahu, that is afflicted. Jupiter is afflicted because Jupiter is between two malefics, Saturn and Ketu, so it's in the Papa Kartri Yoga. Venus is afflicted because it is in the Rahu Ketu axis. So all the factors are there which indicate diabetes or make him susceptible to diabetes, and you have to wait for an appropriate dasha to see when it will happen. So I am concluding here. This was all about, it was just an overview. Those who know astrology, it was all too basic, but if you didn't know anything, at least I have given you an overview of what sort of medical astrology we do and what all can be seen, and also there are many things which can be improved upon. A lot of research is required in dealing with the determination of longevity in the congenital illnesses and so on. So this is what it is. I would be open to any questions.
So,
Any questions, please?
Before you ask question, I just want to clarify about one point, and in a simple way you will understand. He was talking about the timing of event. When will an event occur? So he talked about three things. One is the basic promise in the horoscope. So you see in the birth chart, is there a promise? And then he said the fructification of time. That is determined by the dasha. And the third thing, the quality, well, mild, moderate, severe, whatever, that is determined by the gochar or the transit, or the position of planet at the time of fructification. So I'll give an example. Suppose, simple example, suppose there is a promise of eating a sagar ka dosa in your horoscope. That is in your birth chart. Okay. Now when will it happen? When will your mind say, I want to eat a sagar ka dosa? That will be determined by, as he said, the fructification time. The time in the dasha where your mind will say, I want. And then you will order the sagar that please deliver the dosa to me. That's the second part. The third is what kind of dosa you will get. That will be determined at that time of fructification, what is the position of the planets, where are they sitting, because that will determine ultimately what is the quality you are getting. So three things can happen. The delivery boy starts from the sagar, he meets with an accident, and in spite of the yoga, you don't get the dosa to eat. The second option is that he starts, the delivery time is 15 minutes, he rings your bell in 14 minutes, and you eat a proper dosa. That's a 100% fructification of the event. The third is that he comes from there and somehow his motorcycle, he falls down. He just picks up and the dosa, some is in the pack, some is sticking here, some is sticking here, some is sticking here. And he says, okay, and when you open it, it's all, messed up. But you are hungry. So you will eat an dosa, but not 100%. So ultimately, when an event is going to happen, these three things have to be seen. The basic promise, the fructification and the quality. And this is to be determined by the basic chart, the birth chart, the transit time of the dasha as sir said, and the transit position of the planets. So this will help you in actually understanding the type of event, what is going to happen. And as I said in diseases, the outcome. So when disease is a long-term process. So when you see that after 15 days, the dasha is a benefic dasha, as I said, it will be very good recovery. But if the forthcoming dashas are bad, then you can say that he will go into some kind of a complication and it will take a longer time, or maybe a permanent disability. So I just want to clarify this point. Now it is open to the house to ask questions.
Please.
Sir, this is very, very illustrative and enhancing our vision in many directions.
Now there, it is a retrograde 6th lord sitting exactly on the degree of the lagna, and its dasha is operating, and there is no benefic aspect on this planet or on the lagna, so no relief there. So if there is no relief and there is this definite affliction and a dasha, adverse dasha is operating, you can't do anything. Although, you see, his wife who knew astrology, she pointed out that his health would be, will not be normal, he should go to a doctor. But the doctor did not either see it or, you see, otherwise also, if somebody comes to me and says, okay, I'm not very well, I would certainly not look for the cancer of the stomach. So, we as astrologers have to develop astrology adequately to be able to diagnose things better. We are pretty poor in that because diagnosis is a weak aspect, weak thing for us. Timing we can do. Timing is quite all right. Outcome is also quite understandable. But I think the ultimate good for the patient would be that we are able to diagnose, we are able to help the doctor who is treating the patient, and doctors also are open to astrological studies. And then after that also there will be some people who can be cured, there will be some people who cannot be cured. I think for medical remedies, you want to prescribe mantra, you want to prescribe stotra, you want to prescribe anything. I think that can go along with the standard scientific medical treatment. So I think the remedy has to be in treatment and supported by your this thing, because your astrological remedies don't do any harm, so they might, ease the suffering, might lessen the suffering, so they can go side by side. I would not think that they can replace the standard scientific treatment.
It needs a lot of research. In books, as I said, they were mentioned that gems can be, there are details about everything, but there is no research going on anywhere. So you cannot be, it's mentioned to in the past, thousands years back, all these aushadhis, gems, mantras have been used. Sushruta, as my next CME, next year home will be on Sushruta Samhita then and now. In that, Sushruta Samhita has a chapter on mantra therapy. He has a chapter on animals in treatment of, people say Ayurveda is only, herbs. But he has a full chapter on every animal can be used in which kind of disease. So these are things which are mentioned in Sushruta Samhita, but we need to, come out with this. Lot of things are hidden and not talked about at all. So I think lot of participation of the modern scientific people and research is needed. But there are mention of prevention, there are mention of treatment, there are mention of diagnosis of Vedic medical astrology in the texts.
Yes, sir.
In fact, the moon is moving fast. So one has a psychological, mental effect by moon. Is there any gem wearing which can prolong the, lessen the effect of sudden change of moon? When it is moving fast.
Sir, I am not the stone man. He'll tell you.
So as I said, what you talked about. So you are talking of remedial astrology. Again, you are talking of gems. You are talking. So there are mantras, evidence. Unless we are able to generate scientific evidence, we cannot say with surety. So we need modern medicine people to join in this race, in this study of Vedic medical astrology, and funds to be provided for research. And then because we are in an era of evidence-based medicine and evidence-based healthcare, unless there is evidence for that, you cannot say with certainty that this is going to happen. So evidence is in 3-4 times. Like I did a research in NHI hospital on young MIs. There were 25 cases of MI between the age of 25 years to 35 years. And as I read Sir's book, is a mention of combination for heart attack. So I applied those combination on those 25 horoscopes, and exactly what he said, that the 5th house is afflicted or some.
Then there are many courses which are going on. My own course, they are asking me to start a new course, which I will start sometime. Not yet.
The courses,
But
who's conducting online?
Online courses are there. In fact, there is a regular, course by the Indian Council of Astrological Sciences, ICAS, which is going on in Delhi, and they have branches all over India. I am teaching medical astrology there in one of the branches of one of the schools here. They start from, it's a weekend course, so you have classes on Saturdays and Sundays. They start in January and July, so July session is going to come up soon. So they have 2-year course. So first year is the preliminary one, and second year is the advanced one. And then of course after that they continue with the post-Visharad things and so on. So if you want to study in a proper organized manner, join one of these courses. ICAS, Indian Council of Astrological Sciences. Online courses are available.
Out of Hatke Jara essay, I just want to know, what is this Manglik? We hear so much about the people's horoscope.
That is a very misunderstood concept, Manglik. Well, that is some adverse placement of Mangal or Mars in the horoscope. And it is supposed to affect the relationships, particularly the marital aspect. But it is not as bad as it has been projected to be. So, but then you have to see different horoscopes, where it is bad and where it is not. So that is how it is. But it is not to be considered as, a no-go. Because position of Mars in 5 of the 12 houses causes Manglik Yoga. So, 5 out of 12 people will be Manglik. So, you have to consider it, properly, not like this. Don't consider it as too bad. Yes, sir.
Yes, sir.
Sir, there is a belief that if you become spiritually accomplished, then you raise yourself above the effect of the planetary positions, or basically these are also linked with our previous year karmas. And the karmas are what found timing in the dasha and the garbha. So, what is your take on that? Like Gautam Buddha, he escalated himself spiritually so that you are beyond the physical body, you are close to the astral or the causal body, and the effect of these planets get minimized or nullified totally. And would that be a probability of using for medical cure?
Sir, if you are born in the world, then you remain within the limits of your horoscope. Lord Rama and Lord Krishna, their horoscopes are available. Their horoscopes indicate what events occurred in their lives. So they also did not violate the limits of horoscope. So as an earthling, when you are born here, your horoscope gives you an indication of what your past karmas were, and therefore this part of the karma, as Dr. Swishtha said, that you have to go through. Whether you perceive the pain or you don't, that depends on your own mental and spiritual level, but things will happen. Now, if Lord Rama is not affected by all the ordeals that he went through, then he has raised himself to that particular level, but he had to go through them. So you might, reduce the extent of your suffering because of your attitude towards the suffering. But I think events which have to happen, they will happen. That is my thinking.
Okay, sir, thank you very much.
Okay.
So, thanks everybody. Thanks Dr. Charak for such an enlightening session, and everybody of you taking out of your time to be on a subject which is absolutely on the early stages of revival and restoration, and old fame and name which Vedic science always has.